concealer is not wanting to stay on my nose. Nunny Rose, Nunny Rose. Sucks. I feel like anytime I do my makeup, it will not stay on, just for the simple fact of I always start to get a runny nose. Or as my grandfather and the rest of my family have started to call it, a Nunny Rose. Hey guys, what's up? I'm trying to be a little quiet because it's like 6 or 7 in the morning, probably more so leaning towards 7. But I did another little tutorial and actually used false lashes this time. I'm still not that great at it, and it's kind of more like a fail tutorial than anything, because I keep dropping stuff. I got mascara up on my eye right here, and that's not where it's supposed to go. And my eyebrows, I did them way too dark at first. Way darker than I realized. They're probably still too dark. Looking in the mirror that is directly across from me. Well, diagon alley from me. But, yeah, kept dropping things, kept messing up. Things wouldn't work, and I would just... But I tried. Oh, and I also seriously failed at doing my nails tonight, too. I can't girl. I cannot girl. I'm not that great at girling. Crap. Anyway. Oh, and for those of you who may be able to like see my teeth, I always keep trying to look in the mirror to see if you can see how bad my teeth are, but for those of you who don't know, I have Graves' disease, and I also have hypothyroidism, and then I also have hypoparathyroidism. Of course I'd be able to say that word easier. Yep, my life. But because of that, from the time that I was bedridden, my teeth were pretty much just like destroyed, and I have to be really careful with them now, so I'm kind of just used to it anymore. My teeth have always been bad since I was a kid. It kind of runs in my family. No one in my family has great teeth. But yeah, so I'm trying to eventually get them fixed so I can have nice, pretty, white, straight smile, even if that means getting dentures. You know what? I'm fine with it. I kind of resigned myself to that a long time ago because I have a whole lot of fillings and everything else, so yeah. So I just finished filming a few other videos, including a tutorial for this look, and I wanted to go ahead and do like a little health update. Sorry, I'm sure a lot of you know that I smoke cigarettes and I really need to quit, but you know, whatever. It's my channel, so I'm gonna smoke. But I do not encourage it at all. I'm an adult. I can make my own decisions, but you all don't do it. I really want to quit. As I had stated before in like my little vlog episode thing, I tried to go back to work for a little bit for all of 2 days, and that didn't work. Because my health had actually been doing really great because I hadn't been under like a whole lot of stress or anything. And it was like, after that, I think it was seeing all... I worked at Hallmark. I can't remember if I already said that, but I worked at Hallmark in the local Walmart. Okay, sorry. I worked at Hallmark in my local Walmart, and the shifts were only 3 hours long, and I would start to have my episodes of what I call like Graves episodes or thyroid episodes, and to me, thyroid episodes are things that I've had from the first time I ever started struggling with it, and that is nausea, shaking, anxiety, and just incredible anxiety. But I also overheat very easily, even though I am on more so the hypo side now. So I would come home from work and I would have to just crawl up in a ball, and I could not relax at all, because if I just relaxed the slightest, it made my nausea increase like that much. I mean, it was totally stupid. You know, I wasn't too awful sure what I should do after that, so I ended up quitting because I was just getting myself way too disappointed in myself, and I felt like I was just disappointing my family. And, you know, surprisingly, a lot of my family really backed me up on that. And, you know, I I'm used to kind of being put off as being lazy, or, you know, having no motivation, or not wanting to do anything, not having any plan with my life or anything like that. I'm used to being looked at in that sort of light, and that hurts a lot. And no one other than people who have dealt with this know what it's like and know how hard it is. And it is a battle to get up and try to live every day. Since then, I've been pretty depressed, and you know, I haven't really been doing much of anything. You know, here lately I have been lazy, but it's just like my health has kind of, I have these episodes where it goes from great to horrible, and sometimes it can just go back and forth multiple times a day. I mean, you know, I just go from feeling like I can do anything, like I can conquer the world, to feeling like I'm dying in a matter of moments. You know, all it has to do is just settle in, or, you know, I just have to walk just too much, or, you know, something to that effect. But right now, let me get into my medication and stuff. Yes, my fashionable pill basket. For anyone who knows me personally, I hate medication. I hate it so much. I always have. The only things I would ever take, you know, besides whenever my parents would make me take like cold medicine or something like that whenever I was sick, or like antibiotics, the only thing I would ever take, because I have arthritis in my knees and my hips, I would take Tylenol or ibuprofen. Now I take aspirin every now and then, but, you know, that's all I would take. And this, my daily dose. This is my evening, and this is my morning. It's ridiculous. But good thing is none of them are addictive. None of them give me any side effects, and I even told like my psychiatrist, whenever I'm on three medications actually, for my depression and anxiety. I'm on 2 for the anxiety and 1 for the depression. And I told him right away, I was like, I don't want anything addictive. Like, I don't want anything that will do more harm than good to me, because, you know, my family, we're full of addictive personalities. I'm on Vistaril for my anxiety, and I'm on 100 milligrams of that 3 times a day. And then I'm on 2 vitamins, because I have permanent deficiencies in calcium and vitamin D from the hypoparathyroidism. I'm on calcium 600 milligrams once a day, but I actually have to cut the pills in half because they're too big. They're gigantic. So I just actually, whenever my grandma gave me the bottle, because it was my grandpa's, but, you know, he has another dose or whatever, and so I just I dumped them all out and just took a little pill cutter and stuff. A pill cutter, and just sat there and just was chopping them all up in half, because I was like, this will just make it easier for me. I think I'm on 1,000 units of vitamin D a day. I can't remember. I don't know where my bottle for that is, but yeah, the calcium and the vitamin D obviously are just over the counter. I'm on propranolol twice a day for my heart palpitations, and to try to keep, you know, myself calm and all that other stuff. I'm also on Dexilant, which is for, I mean, those of you who probably take it know it's for acid reflux, and that comes from all of the thyroid issues as well. You know, I keep heartburn, and I never really had a lot of an issue with heartburn until all that. But yeah, so Dexilant, good stuff. I actually got that in samples from my general practitioner. So, and then I'm on calcitriol, the brand name is Rocatrol, and I'm on 0.25s in the evening, and I'm on 0.50s in the morning. I just take one of those. I take one of each once a day. Does that make sense? Oh my god. My thyroid is 150. And I've actually found out that that dose has done pretty well for me. You know, I thought 88 was like my golden range, and apparently, like, with one of my relatives, that's like what she's on too, and I feel like my eyelashes are going crazy. It's because they are. Oh well, I'll let y'all laugh at that. You know, no big deal to me. According to one of my cousins, like, that seems to be her golden range, is between, I think, like 88 and 100, or like 55 and 88, somewhere between there. I can't remember exactly what she said, but because this was a few days ago, and she told me. But it was funny because at first, whenever I had my 112s, because I went from 88 to 100 to 112s, I think to 125s or to 150s. I can't remember if I just went from 112 to 150 or what, but whenever I went to my 112s from my 88, it made me feel so sick. Like, I could not get out of bed, and it was just specifically from taking that amount. But the 150s worked perfect for me. I guess it was just because we kind of worked up to them instead of going from like 88 instead of 100 to 112. We went from 88 to 112. And I mean, that's that's a big difference. So my Graves' disease hasn't really given me too awful much of a problem. The main issues I've had is the depression, the anxiety, and the fatigue. You know, I still have my palpitations every now and then, but, you know, that's nothing I can't handle. I did have to have an ER trip in October. My fiance had to take me to the ER because we'd been playing video games, and we were just having like a little, you know, day in, and we were playing Dark Cloud 2 on the PS4. I love Dark Cloud 2, my favorite classic PS2 game. We were just sitting there playing, and then, you know, we decided to cuddle and relax for a little bit, because, I mean, we were both hurting from sitting up for so long. And I rolled over to where, like, I had my head on his chest, and all of a sudden, I just started feeling like I couldn't breathe. And then my chest started hurting, and my heart was beating so fast. It was what I call a silent panic attack. You know, because to me it didn't feel like a panic attack. But that's what they diagnosed it as. You know, that's what they said what was happening with me. But that was scary because I was called back for an EKG, and I've only ever had one of those done. And that was before my thyroid surgery. So after the EKG, they took me back into the trauma room. And I'd never been back there before. So that had me terrified. And, you know, they started coming in at me and, you know, like, doing all the paperwork and all that other stuff. And I was like, am I gonna die? But, you know, turns out I was fine. You know, because they gave me Ativan, I think that's what it was. And it was like almost instantly, I was relaxed. Instantly. But the IV sucked. I've only ever had 4 other IVs. Or 4 IVs, including that one. I had the one here in the crease of my arm. My thyroid one was right here. Like, right. It was off to the side, either here or here. I can't remember. I did have a little mark, but it's gone now. I had one here. And then that one was here? Or here? I can't remember. Here or here. But yeah, that was, oh God, it sucked so bad. The one that was the worst for me was whenever they had to do it right here on my thumb. That was a nightmare. That one was for my gallbladder surgery. I was cussing at that nurse, and everything like that. She was like, I'm sorry, I'm just trying to do my job. I was like, it's not you, it's not you, it's not you, it just really hurts. I hate being a sickie. Oh, I forgot to tell you. I'm just jumping all over the place. I have 2 more meds that I did not tell you about. I'm on Lexapro 20s once a day. And then I'm also on Buspar. The generic is way too hard to say. Buspirone HCl 10 twice a day. So yeah. But yeah, after that whole health episode at the hospital, I haven't really had that many since. I still have those times where it's just like I'll be like hanging out with family, like on holidays and stuff like that, where I just get so nauseous I have to just come in here and lay down in my lovely air-conditioned room in the middle of, well, getting ready to be winter, in the middle of fall. And I have it set on 61, and that's horrible. But normally whenever I'm awake, I get cold, and then whenever I go to sleep, I wake up sweating. I don't know what's going on in my life anymore. I really don't. But yeah, so I haven't really had any issues with like a whole lot of digestion problems or anything like that. You know, that just like from my gallbladder removal. Everything's been going well there, and my scars have been healing very nicely. If you want me to, I will show you them. This right here. Right here is my thyroid scar. I hate when anybody touches it, but whenever I do it, it's fine. I don't know. Too close. Okay. And then, let me see. I'm gonna show you my chubby belly, because I've gained a lot of weight back. Yeah. Let me see. Okay. Here's my first scar from the gallbladder surgery. And then, that's my tattoo. But I got this one, this one, and then this one. You probably can't see them that well. And then also on my belly button, I have like this weird skin thing. It's actually on a lot of my chest too, but you know, whatever. Please don't laugh. I'm not gross. I wash myself, I promise. But then I have this one right here. So yeah, that was a workout. That was the most awkward positioning I think I've ever had to do for a video. But yeah, so like a lot of my health stuff seems to be going a lot better here lately. I just really have to take it just kind of one step at a time. Like especially with the depression and stuff. You know, I've been doing my best to try to wait until my body fully heals until I can possibly reach remission. And you know, just try to keep positive. And you know, that's what I encourage others to do. Like no matter how bad your health is, or you know what things you're going through or anything like that, it's always best to keep a very positive outlook. Because if you don't, you're just gonna let yourself get sucked into the black hole that is whatever your situation is, and you don't want to do that. Believe me. You know, you just have to really try to learn from experiences, and just know that with every bad thing you go through, there is likely a lesson in there somewhere. You can't hold your bad days against yourself, because otherwise they'll burden you for forever. And I didn't learn all these things until I was bedridden. I've changed so tremendously as a person from just laying there in that bed and thinking about everything bad I'd ever done, and just making myself feel horrible, just being like, why did you do that? You're such an idiot. And the more that I thought, you know, well, I can't change it. You know, I was young, I was stupid. And the more I was able to say that to myself, the easier it was for me to accept the person that I used to be, and in turn that made me let go. You know what I'm saying? See what I mean? You know, it's just, I've been through a lot of things here lately, and it's been very hard to try to keep my head above water, both financially and also mentally and spiritually. It sucks to be you sometimes, but you just have to learn to accept who you are, you know, and that'll make dealing with your health issues and everything so much easier. It'll just make dealing with life in general so much easier. You know, for me, I've learned to not blame everybody else for things that have happened to me. I've learned not to constantly have the outlook on life as, why me? Why did I have to get stuck with this? Why couldn't it be somebody I didn't like? Or, you know, something like that. And, you know, as I've gotten older, you know, I've realized I wouldn't wish this on anybody. Not a single person. Not anyone who's done me wrong. You know, because I know how horrible it is to try to deal with something like this. On the outside, you look normal. And people think you're crazy for just being like, oh, I don't feel good. Oh, I don't feel good. Oh, what was I saying to you? Oh, I can't remember. Or, you know, you just being like, oh, I'm not hungry. Or, oh, I can't stand the smell. Or, it's been very frustrating. But, you know, you look normal on the outside. But on the inside, it always feels like you're dying. Always. Just, it's not necessarily as intense sometimes as the other times. You know what I mean? But yeah, it's been a roller coaster, but honestly, I think I can honestly say I wouldn't change any of it. I don't think I would. Because I know that if I did, I would not be the same person that I am today. And I am damn proud of who I am today. Very proud. You know, people can say what they want about me. And, you know, they can make their own assumptions about what I've been through. But they can never really know unless they get it. But at the same time, you know, Graves doesn't affect everybody the same way. Thyroid disease does not affect everybody the same way. They can never truly know what I've gone through. They can guess, but they can't know. And I can't necessarily hold that against them. So I just let everybody make their assumptions, and, you know, I just move on. I don't hold it against anybody for, you know, trying to say anything bad or, you know, asking questions or any of that stuff, because I feel that people should ask questions about Graves' disease and thyroid disease, and I feel that there's nothing wrong with asking questions. And I've never really felt that any health question for me is too personal. Of course, I'm one of those people that I am not a very personal person, you know. I don't mind. The way I felt about it is, except for very, very touchy subjects to me, very touchy, I am pretty much an open book. You know, I have no problem answering questions or anything like that. In fact, it makes me feel good because, you know, it's letting me help somebody, or, you know, giving someone an answer to even a simple question. You know, it makes you feel good. But I rambled on so much. Oh my god. I can't keep my mouth shut. I come from medication, mental health, depression, helping people, sneezing, runny noses, eyelashes falling off. Do you see this? They're just hanging out. I don't even feel like fixing it. I'm lazy that way. But yeah, you know, if anyone ever has any questions or anything like that for me, feel free to message me or, you know, leave a comment or anything like that. I have absolutely zero problem. You know, except for, you know, what I said I won't talk about, which I haven't been that open about it, but I would appreciate if no one asked, like, any prodding questions or anything like that. I will most likely, I haven't decided if I will, but I will most likely do a video about it in the future. So, or, you know, just talk about it maybe on an Instagram post or something. You know, I'm not really sure that I'm ready to discuss that. So yeah, I hope you guys have enjoyed this video, and I hope that I have helped you guys with like updates and stuff like that, because I got really deep there for a minute. And my crazy eyebrows. What is my life? I have Halloween videos that I plan on uploading. As I said in the vlog, that, you know, they were just a little late and everything, and then my health just started going crazy, so. But I do plan on uploading those soon, and so look for those. I've been trying to get like a backlog of footage going, that way I can, you know, actually have more things to upload. And yes, I know that I'm wearing the same shirt as in the last tutorial, but my cousin recently got me this as like a Black Friday gift, because I have hardly anything that actually fits me properly, and I love this shirt. It's like two of my favorite colors, green and pink. So yeah. But yeah, I guess I'll quit boring you guys now. So I will talk to you later, and have a good day. Goodbye.